Welcome to episode 11 of Reimbursement Readiness, Business Tips for Wound Practice, presented by Kathleen and friends. As promised, I am honored to be able to interview Amiee Coriano about the payer contracting process. Because subscribers have submitted some very interesting contracting questions, I will use those questions during this interview. Welcome, Amiee. Is there anything that you would like to say to the subscribers before we begin?
Ms. Kathleen, I just want to say I'm excited to be here and to help the audience understand the contracting process, as it is a very crucial part of their practice.
Well, thank you, Amiee. And before we begin, I want to remind the subscribers that there is a very good handout that Amiee prepared that is attached to this particular webinar. And she will definitely refer to it, but it has some very common payer contract terms. So, Amiee, I know that your consulting firm assists your clients with credentialing and contracting. But to kick off our interview, will you please refresh our subscribers about the difference between credentialing and contracting?
Sure, I'll be glad to. So credentialing is a process of verifying that a wound ulcer management professional has the appropriate education, qualifications, training, malpractice history required to provide the highest level of care for their patients. Whereas contracting is a legal binding agreement that outlines the terms of the covered services provided by the wound and ulcer management professionals and/or providers, and the payment from commercial or government payer organizations.
Well, thank you. And are contracts required by all payers?
No, they're not required by all payers. A provider or group can choose to be out of network with a plan. This is usually not the first choice, as a patient will have a higher out-of-pocket cost associated with them being out of network. And some plans like HMO and EPO plans, they also do not have out-of-network benefits, so patients with these plans would not be covered for providers who are out of network. There could be some exceptions under a rider, but this is not typically offered on all plans.
And Amiee, what items are included in a payer's contract?
The contracts contain many important sections that the provider and group practice need to review. A few of the most important sections are the plans that are included in the contract, the definitions related to billing, the timely filing limits for the plan types, the provider's obligations, the compliance policy, the effective date of the contract, the compensation provisions, and where to send notices regarding the contracts. Most providers focus on the timely filing limits, the plan types approved, and the fee schedule. The timely filing limits are crucial to understand how long the group has to successfully submit their claims to the payer for payment. The fee schedule lists the allowed amount rates per CPT and HCPCS codes for each approved plan type. The different plan types can include HMO, PPO, EPO, FFS, Medicaid replacement, and Medicare Advantage plans. In addition to different payment rates, each plan type can have separate coverage policies and benefits. Some plans may cover treatment based on specific criteria, such as the covered setting, while others may not cover a service at all. An example from a contract that I recently reviewed stated, covered services means that healthcare services for which a participant is entitled to receive coverage under the terms and conditions of the participant's benefit plan. Just because you have multiple patients with the same insurance company does not ensure that all the patients have the same plan benefits. Although providers are particularly interested in these contract sections, they should take the time to read the entire contract before signing it. They should clearly understand their responsibilities as well as the plan's responsibilities.
So, Amiee, will you please give us some examples what you mean by the provider and payer responsibilities that are in the contracts?
Sure. There was an example in one of the contracts that I just recently had, and it's listed under the section in the contract that states representative providers shall provide covered services with the same standard of care, skill, and diligence customarily used by similar providers in the community, the requirements of applicable laws, and the standards of applicable accreditation organization. The contract also outlines the importance of complying with the medical records and the utilization management requirements. A section of the contract outlines that the duties of the health plan include notifying the providers in advance if the list of benefits change for a certain plan listed in the contract so that providers are aware of the change and the effective date of the change. They also advise the patients of the provider's participation status for their plan type, and they advise patients how claims will be paid. In the handout provided with this podcast, subscribers will find the definitions of the common terms found in the contracts, as well as the definitions of the different plan types.
So, Amiee, if a provider does not see a service, procedure, or product on the plan's fee schedule, is it possible to get it added?
Yes, the provider should reach out to their insurance contracting representative. So when we send the contracts, there's a representative that will email you back. And then you can inquire about the coverage and the associated fee schedule for a service, procedure, or product that is not listed. Typically, if the payer agrees to cover and pay for these services, procedure, or product, the payer will send a contract addendum that includes the updated information.
Okay, so if a provider adds a new service, procedure, or another provider or a product after the contract is signed, is it possible to get those added?
Yes, you would want to notify the person that does your contracting, and that contracting representative should contact the payer and submit the new information. Each insurance company has its own process for adding a new service, procedure, product, or providers. Therefore, the provider's contracting representative should learn the rules and what is required by each payer. For example, a section in the contract labeled changes to represented providers explain the payer's process of adding a new provider and the allotted time frame to update this information.
Well, thank you. Now, Amiee, what about if a provider wants to renegotiate their contract? When should they begin to renegotiate an existing payer contract?
Sure. Renegotiation should begin well before the renewal date and should follow the renewal process outlined in the contract. Any changes that are needed or wanted are usually required to be submitted in writing for the payer's review and response. Please note that the provider should submit robust data to support their negotiations for their new services or their contract rates.
Yes, I agree with that. Everybody I've talked to said that the person with the most data wins when it comes times for contracting. Now, Amiee, what do you think is the biggest contracting mistake that providers make?
Sure, there's a couple. The biggest contracting mistake that providers make is allowing staff, a consultant, or a billing company that is not familiar with the process and requirements for contracting. This mistake can wreak havoc on the operations and financial side of the business if it's not done correctly. The second biggest mistake providers make is signing their payer contracts without reading the entire contracts to ensure that all services, procedures, and products are covered. They also overlook the plans that are covered in the contract and assume that all payer plans are included in their contract. I have also witnessed firsthand providers who do not review the effective date of each payer's contract and begin caring for patients prior to the start of their contract. That mistake caused claim denials based on the policy type and the coverage of the patients.
Thank you, Amiee. Now, before we close, I really want to thank the subscribers for submitting such good questions about contracting. In addition to the endless topics that we plan to cover, we welcome subscribers to keep submitting questions and/or topics that you would like us to address. And my email address is kathleendshom@gmail.com. When you submit questions and/or topics, my reimbursement friends and I will do our best to address those questions and topics in future episodes. So, Amiee, thank you very much for sharing contracting information with the subscribers and me. And we appreciate your experience and guidance in the last 3 episodes where you were absolutely able to answer the questions of our subscribers. I also want to thank all of the subscribers and followers of Reimbursement Readiness. Without you, we don't have anyone to educate. So please watch for the release of episode 12, when I will be discussing the 2026 final Medicare payment rules. Until then, I look forward to talking to you. Have a great day.